Good morning, everybody. Yesterday to 8 p.m. we had 157,000 tests in New South Wales, which is a healthy number. We encourage people to come forward and get tested. However, our community transmission numbers are disturbingly high. We had 478 cases of community transmission to 8 p.m. last night, and we can't stress enough how hard all of us have to work to reduce these numbers, to reduce the growth of the spread, and to make sure we're all staying home unless we absolutely have to do otherwise. Can I also extend our heartfelt condolences and sympathies to 7 families who've lost a loved one to 8 p.m. last night, 7 deaths in New South Wales. Dr. Chant will provide those details. Unfortunately, only 2 of them had 1 dose of a vaccine and all the others were unvaccinated. And tragically, since that time, we also had that 8th death of the very young teenager, and Dr. Chant will go through those details as well. We know the vaccines are working, and it's important for all of us to protect our loved ones and ourselves by getting vaccinated, but please know that when you do get vaccinated, there is still, it takes 2 to 3 weeks for that first dose to take effect. So don't assume you're protected as soon as you get the jab. Please assume you have the virus, or anybody you come into contact with has the virus, and make sure that you continue to follow the rules as strictly as you can. In terms of Sydney, of course, southwestern Sydney and western Sydney remain those areas of most concern, and the suburbs I'm about to read out are the ones that are continuing to have escalating cases. Marylands, Guildford, Granville, Blacktown, Mount Druitt, Yagoona, Greenacre and Bankstown. So these are the suburbs where the growth is continuing, and we really need people in those communities just to stay home. Don't leave your house. Don't cut corners unless you absolutely have to. We just want people to stay still. Of course, also in Western New South Wales, we are very concerned about communities in West Dubbo, in the Walgett area, and those remote communities in far western New South Wales. And we again ask everybody to stay home and not to move around. And I especially wanted to acknowledge and thank all the staff working with our Aboriginal communities on the ground to protect those communities. And I say thank you to the staff who have been receiving some support from the federal and state governments, and we appreciate all the work they're doing on the ground. Can I also stress this week, with great delight, we heard about the extra 500,000 Pfizer doses New South Wales is receiving. In addition to that, we start our program today of vaccinating 100,000 authorised workers in those key local government areas of concern. But we're also asking everybody who's between the ages of 16 and 39 in those local government areas of concern to be on alert through your employer or through New South Wales. You'll be receiving an invitation to come and get the jab this week. We ask you to book in and come and get the jab to make sure that you're protected and make sure you don't get the virus or spread the virus when you're working and then unintentionally take it home to your household. We also have with us today Nurse Sarah Fletcher, who is responsible for providing some of the pop-up clinics, and she's going to talk to us today about what's involved for those of you who want to come in and get the jab. Can I also acknowledge today Commissioner Fuller and the New South Wales Police Force start their operation Stay at Home. Commissioner Fuller has been working at it with his team to make sure the operation goes off not just successfully but with a presence like we've never seen before. Compliance is an issue. It only takes a handful of people to do the wrong thing to cause a setback for all of us. So I thank Commissioner Fuller for his activity in that regard, and we'll hear from him as well. So now Dr. Chant will provide the health update. Then Commissioner Fuller will provide the police operations update. The Deputy Premier, John Barilaro, will comment on regional New South Wales, and then Nurse Sarah Fletcher will tell us about the great work she and her team are doing in terms of pop-up clinics and how people can access the vaccine throughout Greater Sydney, but of course also in particular during those hotspots. Thank you.
Thank you, Premier. So disturbingly, we saw 478 locally acquired cases of COVID to the 24 hours to 8 p.m. last night. Too many people are infectious in the community, and it is critical that we all heed and take part in the actions we're required to undertake. Stay home and leave your home for the most minimum of time, and every time you're out and about, assume you have the infection or that you will come in contact with anyone else that may have the infection. It is critical that we protect ourselves and our loved ones from COVID. I'm particularly concerned at the moment around Dubbo and the impact COVID is having on Aboriginal communities in Dubbo, and also that the fact that Aboriginal vaccination levels are not as high as I'd like to see them. So just to be aware that we are working with the Commonwealth to increase opportunities for vaccination in impacted areas in Western New South Wales. Also, I want to just advise people that even if you're immunised, fully immunised, you still have to follow all of the rules. I also just want to reflect on the deaths. And we have the deaths of 7 people reported. And it is important that we understand the true impact that COVID is having on the community and why it is so critical we all play a key role in protecting our loved ones from disease. There was a man in his 80s from southwestern Sydney died at Campbelltown Hospital. He was not vaccinated. There was a man in his 40s from southwestern Sydney who had severe underlying health conditions and was not vaccinated. A woman in her 70s from Sydney's northern suburbs died at Royal North Shore Hospital. A woman in her 80s from Sydney's inner west died at Royal Prince Alfred Hospital, and she was a resident of the Wyoming Residential Aged Care Facility and is the 3rd death list linked to this cluster, and she was unvaccinated. There was a man in his 70s from southwestern Sydney and he died at Liverpool Hospital, and he was a patient on the geriatric ward at that hospital and was the 8th death linked to that outbreak. He had had 1 dose of AstraZeneca. And a man in his 80s from southwestern Sydney died at Campbelltown Hospital and he was not vaccinated. He had a number of comorbidities that sadly contributed to his death. There was a man in his 80s from Western Sydney that died at Nepean Hospital. He was not vaccinated. He also had severe underlying illness. There was a young boy, tragically a 15-year-old from southwestern Sydney, died at Sydney Children's Hospital. I can confirm that he died from pneumococcal meningitis. He also was a COVID positive case. He had been vaccinated against pneumococcal disease as a child, had received some vaccines, but it is important to know that the vaccine may not have covered the particular strain that was involved in his death. The death of anyone is tragic, and it stresses the gravity of the situation that I've announced those seven deaths. And can I extend my personal sympathies to the families and friends of the patients. In terms of Nepean Blue Mountains, we have seen no new cases at Nepean Hospital, but we have seen about 30 cases across the Nepean Blue Mountains Hospital across 2 different exposures. There has clearly been an outbreak in the mental health facility there, and also across some other wards in Nepean Hospital. I just want to confirm that Nepean Hospital, including emergency department, remains open, and all precautions have been put in place to protect both health and staff and the health of patients presenting to that facility. In terms of sewage surveillance, we have had sewage indicating the presence of the fragments of the virus in the sewage in Burke, Lennox Head, Parks, Wallacia sewage treatment plants, and we have not had identified cases in those facilities. So again, we need to be cautious everywhere at this current time. My final note is around vaccination, and it's amazing to have you here to talk about the grassroots initiatives you're putting in place to vaccinate the community. But it is so critical that we take up the opportunity we have, which is to get a vaccine. Also, I do want to be clear that vaccines take a while to work, 2 to 3 weeks, and also that 2 doses is better than 1. So please do not put off having your 2nd dose of vaccine. Please come forward and get your 2nd dose as well promptly. In relation to the AstraZeneca, we're advising that that interval be brought forward in that range of 4 to 6 weeks, and talk to your GP if you've had it prior to that and are due for your 2nd dose. Thank you.
Morning, Premier, Ministers, ladies and gents. The New South Wales Police Force and Australian Defence Force Operation Stay at Home commenced at midnight last night. Nearly 18,000 police and what will build up to 1,800 members of Australian Defence Force will be enforcing the health orders, not just in the Greater Sydney area, but right across the state of New South Wales. You can expect to see high visibility policing right across the state. Yes, there will be a focus on those LGAs of concern, and that is about trying to stop the spread of the virus, particularly those people who are positive COVID moving around. Can I say that from my perspective, overnight we've seen nearly 500 infringements written for a range of health orders. 120 of those were people for not wearing masks, and other were a mix of the health orders. And over the next 21 days, the New South Wales community need to know that we are out there enforcing these health orders to stop the spread of the virus so we can come out of lockdown. I don't apologise for that. We all want the same thing, but we need a circuit breaker from a law enforcement perspective, and that started at midnight last night. Thank you.
Well, can I start by, of course, passing on my condolences to those that have lost loved one overnight with this recent outbreak. My updates for regional and rural New South Wales. Western New South Wales is touched on, and the focus is Dubbo, where we are really concerned, and Walgett. There were 35 cases overnight. That does remain a concern for our health network and those communities. And my message for those all in Dubbo, we know how interconnected those regions and those communities are, is to please follow the health orders, the stay-home orders, and try and minimise mobilisation. The Hunter New England has stabilised, even though with 16 cases, they were all either close contact or in isolation. The Central Coast, only 2 cases. North Coast, Tamworth and Armidale, no new cases, which is a good sign that in parts of the state we are on top of it, showing clearly that the sharp lockdowns do work. Sewerage surveillance, as Dr Chan touched on, are concerning in Burke, Parks and Lennox Head. So again, for those committees, be vigilant, stay in front of it. If you have symptoms, of course, get tested. And again, the message for everybody in the regions, if we follow the rules, stay home and do the right thing, we can come out of this lockdown sooner. Thank you.
Good morning, everyone. Thank you for the welcome. My name is Sarah Fletcher, and I'm a nurse manager working as a part of Sydney Local Health District's screening and vaccination program. As we know, vaccinations are an essential way we can protect ourselves, our loved ones, and the entire community from the effects of COVID-19. Vaccinations are available at New South Wales Health vaccination hubs, general practitioners, and pharmacies. Your first step to access these is to use the eligibility checker available through the New South Wales Government website. If you are eligible, you can book in at your nearest clinic. In Sydney Local Health District, we have also been running community pop-up clinics since late July. We have focused on the southwestern pocket of our district in suburbs such as Lakemba, Greenacre, Campsie and Riverwood, and other areas with vulnerable populations such as Glebe, Redfern and Waterloo. Our community pop-up clinics have been extremely successful because they remove the barriers to accessing a vaccine. Some people don't have phones or computers or Medicare cards. Some people don't have transport, and many don't have English as a first language. With these pop-up clinics, we have the capacity to go to vulnerable communities rather than having them come to us. And we make it a very easy process. For example, last week we set up 2 overnight clinics on site at Sydney markets for the night workers who would have found it challenging to attend the vaccination hubs during the day. We have worked hard to engage with community organisations such as the Lebanese Muslim Association and local GPs to build trust within our communities, because people are more likely to come forward if their own community leaders are involved. We've also worked with trusted organisations such as the Exodus Foundation and Mission Australia to reach the homeless or those at risk of homelessness. Initially, we found that some people were hesitant about the AstraZeneca vaccine, but with the support of local trusted GPs and staff in our clinics providing information and education, they realise that AstraZeneca is safe, and we've seen a real uptake since we started. So what happens when you come to one of our pop-up clinics? Firstly, vaccinations are free and you don't need a referral or a Medicare card. Just come along with your ID, and if you are eligible, you can receive your vaccination then and there. When you get there, you'll be greeted by our staff, and to guide you through to get your vaccine, we have a wonderful team of cultural support workers, interpreters, and administrative support staff. Before your vaccination, you'll be asked some simple health questions, and you'll be provided with information about the vaccine. And you'll always have the opportunity to ask any questions before you go any further. The vaccine itself is very quick to administer. Once you roll up your sleeve, it takes seconds, and our amazing vaccination staff will make the process as comfortable for you as possible. Once you have had your vaccine, you will wait for a short time in an observation area in our care, so we can make sure you are well immediately after getting your vaccine. And once you have been given the all clear from our staff, you are good to go. It is important to recognise that depending on daily demand, there may be a wait to receive your vaccine when you do come to one of the pop-ups. We do really appreciate your patience with this as we work hard to get everyone vaccinated safely. Since July 28, we have administered over 7,500 vaccinations across our Sydney Local Health District community pop-up sites. This is a phenomenal response from the community, and we look forward to seeing even more people come along. It has been extraordinary to see everyone come through, and we are definitely seeing momentum building. More and more people are coming along to every clinic that we hold, and it's so encouraging to see that people are keen to be a part of the change. All in all, the response has been outstanding, and we look forward to continue collaborating with communities as a part of this vaccination effort. Now, just a reminder, to access vaccinations more broadly, head to the eligibility checker first. It's available on the New South Wales Government website, and if you can make a booking there, please do so as soon as you can. Thank you.